I would be remiss if I didn't ask you about mental health. You mentioned that so many who are finding themselves homeless are grieving because they've lost people to COVID. I'm sure experiencing pretty severe levels of trauma. What role does mental illness or mental health in general play in the homeless community and people becoming homeless?
So I think there's sort of two pieces to this that are very important. One, in terms of people experiencing street homelessness, the level of mental health need and mental illness that's untreated is staggeringly high, right? And all too often, the intervention that we see is law enforcement. But in fact, for individuals who are experiencing chronic mental illness, there is nothing scarier than being approached by, a member of law enforcement, and it is absolutely the wrong intervention. And so we need to see more, trained staff, more trained outreach workers who can sort of increase the mental health capacity of people on the street who can work with individuals who are sleeping on the street or who are sleeping on the subway system, to engage them, to begin to provide them with the type of assistance that can help to bring them indoors, give them access to services. And that is long-term work, right? You develop the relationship over time. Sometimes you're going back to the same individual over and over in order to build the trust that will help them to engage with services. And ultimately, the answer is supportive housing, because in supportive housing, you can ensure that people get access to mental health treatments. And we do not have enough supportive housing in the city, and definitely not in the country. So that's one sort of area of mental health need. The second area of mental health need, which is more in the vein of what the partnership is addressing, is that again, we recognize that it's a housing first approach, and that it's the first thing is making sure that people have a roof over their heads. But then in terms of creating stability, there are so many families, so many women-headed households where they are also grappling with untreated abuse issues, untreated mental health needs. So many women who've experienced domestic violence, or where the abuse that they've experienced is more historical, and they've never had access to therapy. They've never had access to any kind of emotional well-being services. And time again, in having meetings individually with clients or in group meetings together, they will name these issues and have named these issues for the organization, which is why we began to build out mental health and emotional well-being services. But making sure that they're appropriate, right? So very often what people are looking for are peer support groups. And one-on-one counseling, that where the counselor understands the circumstances of the family and the community that they're living in, and there is definitely a dearth of support for those kinds of services, and it's one of the things that we're seeking to build. I mean, the reality is that unless we can help to stabilize people, provide them with support and stabilize them in their homes, they are more likely to sort of cycle in and out of the crises that cause homelessness in the first place.